Hello everyone, my name is Catherine Apps. I'm a student physical therapist assistant at Jeff State, and today I'm going to be telling you about a disease known as rhabdomyolysis. Throughout my presentation, I'm going to be holding up my PowerPoint slides to kind of help you follow along. So here are some things to think about. Have you ever suffered from fatigue or noticed your urine being darker than normal? What about experiencing muscle soreness or pain in your joints after strenuous exercise? Usually people wouldn't think twice about tiring so easily. Maybe they just had a bad night's sleep. Many people see dark urine and automatically think urinary tract infection, and think it's normal to be sore and achy after a good exercise. Many of these symptoms do have a simple reason for occurring, but if you are experiencing all of these symptoms together, something could be seriously wrong. You could be suffering from a disease known as rhabdomyolysis. Anyone can be affected, but men have a slightly higher chance of being diagnosed with this disease than women do. Rhabdomyolysis is a medical disorder that affects the kidneys. This disease results from the harmful overload of damaged or destroyed muscle cells. Muscle damage can occur for many reasons: viral infections, traumatic injury, or even an allergic reaction to medication. Once a muscle is damaged, it releases a substance known as myoglobin. This substance enters the bloodstream, which is when the toxicity begins. It then falls on the kidneys to filter the myoglobin from the bloodstream. The kidneys experience great difficulty trying to filter out the substance because it blocks structures within the kidneys, resulting in kidney damage and even kidney failure if left untreated. To be more specific about the causes of rhabdomyolysis, a common traumatic injury would be a crush injury. With a crush injury, the muscle tissue cells are harmed directly, which initiates the chain effect of myoglobin entering the bloodstream and the hardships of the kidneys. Other risk factors include genetic muscle disease, alcoholism, especially when a person experienced muscle tremors, drugs, especially cocaine, heroin, amphetamines, and statins, ischemia or necrosis of the muscles, which could occur with DVTs or arterial occlusions, seizures, heat stroke, and several other risk factors. Other physical causes could be electrical shock. One last major cause is disturbances of electrolytes and metabolism. This can occur with hypothyroidism. If sodium levels are too high or too low for long periods of time, low calcium and high potassium as well. Symptoms that correlate with this disease include abnormal urine color, decreased urine production, myalgia, weakness of the affected muscles, and general weakness, along with muscle tenderness. There are several exams and tests that can be done that rhabdomyolysis would show positive on the results. These tests include creatine kinase, also known as CK level test, serum calcium, serum myoglobin, serum potassium, urinalysis, and urine myoglobin test. There are also several other tests that could be performed. When testing for rhabdomyolysis, a patient's potassium levels could be elevated, known as hyperkalemia. Their calcium levels could be low, hypocalcemia, and about 25% of patients diagnosed with this disease have abnormal liver function tests because of liver damage as well. The creatine kinase level test is the most reliable when it comes to diagnosing a patient for rhabdomyolysis. This is because once the muscles are damaged, they also release the enzyme creatine kinase, making the levels of this enzyme 5 times higher than normal, which leads doctors straight to rhabdomyolysis. High creatine kinase levels also indicate a higher possibility of acute kidney failure. The sooner you seek treatment, the better. Outcomes vary with each patient, but most importantly, it depends on the amount of kidney damage. This disease affects a person's strength, range of motion, and quality of life. Compartment syndrome is also a very serious complication that could occur from rhabdomyolysis. With this complication, a location within the body, referred to as compartment, has a buildup of pressure. This pressure can affect everything within that area of the body, from nerves and blood vessels to muscles. As a result of lack of oxygen, tissue death occurs. Usually, a surgical procedure known as a fasciotomy is performed to relieve the pressure. In more extreme cases, a skin graft is necessary to replace the damaged tissues. If this were to occur, physical therapists and physical therapist assistants could assist with wound care treatment by applying electrical stimulation, providing debridement to remove damaged tissue, and dressing the wound properly. If caught in time, rhabdomyolysis can be successfully treated and the affected person can return back to their normal, healthy life. Fluids containing bicarbonate are most successful in flushing out the kidneys to rid the now harmful myoglobin. These fluids can be given through an IV, but in more severe cases, kidney dialysis may be necessary. Oral medications may also be prescribed if patient's urine output is an acceptable amount. Diuretics and bicarbonate are examples of appropriate oral medications. For crush victims, it is sometimes necessary to begin IV treatment before the patient is even removed from the accident. The recommended range for IV fluids is between 6 to 12 liters over a 24-hour period. With patients suffering from acute kidney failure, renal replacement therapy would most likely be necessary. Hemodialysis and hemofiltration are possible modalities. Both exchange solute and remove fluid from the blood across permeable membrane. PTs and PTAs can also address range of motion and strength issues with the rhabdomyolysis patients. Patient education is also very important to ensure the patient understands the effects of their disease and the importance therapy can have on their outcome. The rate of progression of this disease will determine the patient's tolerance to physical therapy. The cause that led up to rhabdomyolysis is also a factor that affects physical therapy. If they've had a traumatic crush injury, they could be immobilized for an extended period of time. Every case is going to be different, so we as therapists should just be cautious to the severity of our patient's disease. Rhabdomyolysis affects about 1 out of every 10,000 in the U.S. As we mentioned just a bit ago, if caught in time, this disease can be successfully treated. Mild cases usually return to pre-disease state within 3 to 4 weeks. Rhabdomyolysis affects about 1 out of every 10,000 in the U.S. Oh, sorry, just mentioned that, guys. There are about 15% of cases of acute renal failure. Of those 15%, an estimated 8% are because of rhabdomyolysis. More severe cases, however, continue to have problems with fatigue and muscle pain. If left untreated, rhabdomyolysis could cause further complications such as acute tubular necrosis, acute renal failure, harmful chemical imbalances in the blood, and low blood pressure, which leads to shock. The best way to prevent rhabdomyolysis is to stay hydrated by drinking plenty of fluids, especially after a strenuous workout or exercise. This will dilute your urine and flush out any myoglobin from your kidneys that is released from your damaged muscles. It is very important for marathon runners and athletes to warm up and cool down after activities, while refueling with electrolytes and water throughout an extended period of time, because athletes are most susceptible to exertional rhabdomyolysis. Overall, rhabdomyolysis is a very serious disease. It affects a person's range of motion, energy level, strength, and most importantly, their life. If treated in time, the outcomes are positive, but if left untreated, it could become deadly. It is very important to remember to stay hydrated and see a doctor if you notice anything that is out of the ordinary for your body. After all, no one knows your body better than you do, and it is better to be safe than sorry. And that's the end, guys. I hope you guys enjoyed my presentation. Just let me know if you have any questions. Thank you.